Thanks for sticking with us here. It is 7:38. Glad you're here with us on this Monday morning. So last hour we talked with the River Valley Behavioral Health in Owensboro about how prevalent fentanyl is in our community. So we want to talk more about it now, but more so about saving lives, prevention, if you will. So Megan Phillips is the nurse practitioner for over there. So Megan, thanks for coming back and talking with us, and you'll be back with us again in our next hour. We talked about the overall fentanyl crisis,
yes.
the epidemic when we were together last hour. What do we do? How do we stop this? How do we try to end this?
So, our primary focus is education and harm reduction. We want to make sure that we are getting out there and educating our youth, our adolescents, our adults. The more people that we educate, the more lives that we are hopefully going to be able to save.
So where does this education take place, and what is being done? I mean, you can look at someone right now and say, don't touch fentanyl, it's bad, it can kill you.
Right.
But where do you go past that?
So we've gone into factories, different companies. We'll go into schools. Wherever we're asked to go, we will go to educate on not only the uses of Narcan, but also fentanyl education. Anywhere that we're asked to go, we will show up.
What type of education is taking place? Is it just letting people know how bad this is, or it can be laced into other medications and not knowing? What type of education do you give? Yes,
so we are educating on, pressed pills that are pretty prevalent. We're seeing a lot of that now. They look very similar to what the actual medication is, so it's hard to know what you're getting whenever you are taking, a pill. We also talk about the DEA has a campaign that's called One Pill Can Kill. Mm-hmm. This campaign was created to help raise awareness of the counterfeit pills that are being marketed as legitimate. We're hoping that, through this campaign, that people will think twice before they take a pill from, a family member, a friend, a stranger.
Well, that's exactly what I was going to ask you is, how are people getting their hands on this? Is it someone saying, oh, my knee is achy, and you say, oh, here, I got a medication that can help that out? Is that what's happening, or?
Sometimes, but not always. Okay. No, we're seeing a lot of the pressed pills that are being marketed as Percocet. They're called blues. Is what they are being marketed as, and people are not knowing exactly what they're getting. There's no way of knowing how much fentanyl is in these pressed pills. But yeah, they're actually being, people are making these from their own homes.
Wow.
Yeah.
That's just crazy to think. Now, earlier, a moment ago, you had mentioned Narcan. Mm-hmm. Does that include, do you all educate on Narcan as well?
Correct, we do. We offer trainings on Narcan, how to give Narcan. We will also give out Narcan, and there are other programs within the community that do the same. There is also a website that you can go to. It's called finddaloxone.ky.gov, where you can also access free Narcan.
So, if I have some Narcan on me, for example, and I guess someone's maybe overdosing, and I use the Narcan, I mean, am I protected for just trying to help someone's life?
Yes. Kentucky has the Good Samaritan law, which is another thing that we also like to educate about, is that, if you're with somebody who's experiencing an overdose, as long as you stay with the individual until help arrives, if they were to come in and they were to find, whatever, drugs, in the home, a lot of people, what we're seeing is that a lot of people are afraid to call and get help because they're afraid that they're going to get in trouble. So through the Good Samaritan law, it protects that person from being prosecuted or charged with anything. Again, as long as they stay with the individual until help arrives.
So that is the key, is staying there to explain what happened and what's going on.
Correct.
So are we at the point, I mean, when I leave work for the day, I grab my keys, my wallet, maybe some pocket change. Are we at the point right now where we should grab that Narcan dispenser as well, just in case?
I don't think it's a bad idea. I do think that, you know, we are to that point. I know a lot of people who will keep it in their, you know, in their cars or in their purses. You just never know when it might be needed.
All right, Megan, well, we got to go here to get to commercial break, but we'll be back with you again in our next hour here, just talking more about Narcan. Of course, as you see in the graphic here behind me, we have a special. It's going to be called The Next Generation, Breaking Fentanyl's Grip. It's going to air tonight at 8 p.m. right here on the CW7. And then you can watch it again on March the 26th. That's a couple days from now at 9 o'clock until 10 o'clock on our sister station, ABC 25. Time for a break here. It is turning 7:45. Ron's forecast for you is coming up next.